Hello, everyone. My name is Linda Muyumbu. I work with FHI 360 as a regional advisor for strategic information, monitoring, and evaluation. I support countries within the SARO region, and I'm part of the 2024 Signature Journey. My leadership title is Meaningfully Measuring Capacity in Locally Led Development, a landscape analysis, and it's the theme of building integrated and resilient health systems. I'll follow this presentation outline. I'll start with the why and finish off with acknowledgements. So why this particular topic? Sub-Saharan Africa leads the rest of the world in reducing new HIV infections and related deaths. And this is good progress. However, the resiliency of local health systems to sustain the gains, as well as to recover from unanticipated shocks, remains a challenge. The US government, through PEPFAR, has significantly supported the HIV program in Sub-Saharan Africa. And according to PEPFAR, sustaining these gains will be a multi-decade long effort that will also require strengthening the capacity of local organizations to ensure that they can lead, manage, and also monitor these interventions beyond donor funding. Despite PEPFAR's investments in capacity strengthening interventions to date, there's no consensus on how to meaningfully measure. And this is as a result of different reasons. There are different definitions that are applied. There are also limitations in the tools that are used to conduct capacity assessments. There are challenges in selecting appropriate indicators, as well as establishing causal links between the capacity strengthening interventions and the capacity improvements, and lack of clear and logical theories of change to form the basis of meaningful measurement. So specifically, I set out to conduct a landscape analysis of the current tools and approaches that are used to measure capacity in DREAMS programs and evaluate these against the PEPFAR's capacity strengthening framework. My research question was, how effective are the current tools and approaches in measuring capacity relative to PEPFAR's expectations? In terms of methods, I conducted an electronic anonymous survey using MS Forms among 7 M&D practitioners working on different PEPFAR programs between 2016 and 2024, both in Malawi and Kenya. They had each conducted a capacity assessment in the past 5 years. And through this process, I identified and conducted a landscape analysis of the 6 capacity assessment tools against 8 key characteristics that you'll see shortly in the results. In terms of outcomes from the survey, out of the 6 tools, the site improvement through monitoring system, SIMS, was the most commonly used tool at 38%. And looking at how these tools assessed the different PEPFAR capacity domains, they focused on organizational capacity and individual workforce against the other domains. In terms of outcomes from the landscape analysis, these tools were developed and revised between 2009 and 2020, and an analysis of the tools against 8 key characteristics that make a tool effective from the literature showed that only one of the tools focused on organizational capacity, and only one of them actually included critical and relevant capacity strengthening dimensions as defined by the PEPFAR capacity strengthening framework. And all the tools were effective in identifying strengths and gaps that could lead to meaningful improvements. How have I embodied the leadership journey pillars? All the aspects have been useful. Just like to highlight the assessments for me helped to magnify my leadership lens and increase my self-awareness. Through project implementation, it's been a tough journey. I had to bounce back a couple of times, and as a result, I've improved my resilience and also relinquished the need to be perfect. I'm also more sensitive in delivering effective feedback as well as receiving the same. I've also become a thought provoker rather than a solution provider through improved listening and empathy. And through this leadership project, I also got an opportunity to collaborate with another team and published a poster and submitted a manuscript looking at locally led development. So what next from here? I intend to refine and finalize the analysis and disseminate the results to my colleagues internally and leverage external opportunities to reach a wider group of stakeholders and continue building my leadership skills based on the blocks that have been laid. I'd like to acknowledge WomenLift and the whole team led by Nora for this opportunity to be part of an innovative platform to uplift women leaders in global health, my employer FHI 360, my supervisor and colleagues, my mentorship team, and my accountability partner, Masika, for peer feedback and encouragement, the allies who participated in the survey, my coach, Tess, my mentor, Caroline, all members of the 2024 signature journey that have supported me in one way or another. Thank you very much for your time.